So today I'll be demonstrating some exercises that you can do if you've hurt your knee skiing. So we recently covered a blog about anterior cruciate ligament injuries. So if you were skiing and you suddenly twisted or felt a pop and your knee gave way, the chances are you may have injured your cruciate ligament. So I'm going to demonstrate a couple of exercises that you can do to start to switch back on the muscles. Pain and swelling do tend to inhibit the muscles, especially your quadricep muscle here, your thigh muscle. So I'm going to show you that exercise first. So what you're going to do is either sit on a flat surface or on the floor. Don't do this on the bed because the chances are your leg will just sink into the bed. So it needs to be a flat, hard surface. And you're literally just going to push your knee down into the bed or to the floor and squeeze this thigh muscle. Going to hold it for a count of 5-10 seconds and then relax. Okay, and you'll know you're doing this right because what you should see is your kneecap glide up towards your hip. So if you go again, so squeeze and hold it there, 5-10 seconds. And in an acute injury, so if you've just hurt your knee and your knee's still quite painful and swollen, it's okay for it to feel a bit tight and achy, but you don't want to feel any sharp pain when doing this. So how many repetitions should you do? So basically what you want to do is squeeze and hold 5 or 10 seconds, repeat that 10 times, 3 times, and then repeat that 2 or 3 times a day. The other exercise that's good to do is also following a knee injury. The chances are if you have ruptured your cruciate ligament or torn some of the fibres is because of pain and swelling, you will have restricted knee bend. So the other exercise to do, a good one to do, would be to actually just bend your knee. So just slide your heel up and then just bend your knee. The chances are if you've got a lot of swelling, it will feel like a real just tight band. It's okay to push through that, again, as long as you're not getting any sharp pain. So what you might want to do is just use your hands to just try and pull that knee in a little bit further and then just hold it at the end of your movement there. So hold it for 10 seconds and then you can relax it down again. Okay, and again, if you repeat that one 10 times, hold for 10 seconds, do that 3 times, and if you repeat that 2 or 3 times a day. So that's just bending your knee. Again, if you reach a feeling of a tight band, that's okay. Try and pull your knee in a little bit further and hold it just the end of your movement for 10 seconds. And then gradually each day, what we'd hope is you can gradually get further and further until you have that full range of movement.